Welcome to the Ross University School of Medicine breast presentation. My name is Dr. Soraya Djadjo, and I will be guiding you throughout this presentation. There are three main learning objectives. First, breast examination. We will define a breast exam, look at some indications, challenges, and how it is performed. Next, we will explain how an axillary lymph node exam is performed. Lastly, we will discuss disease of the breast. What is a breast examination? It is used to detect breast abnormalities or evaluate patient reports of symptoms. There are of two main types. One is a clinical breast exam. This is a physical examination of the breast, and it is done by a healthcare professional who uses his or her hands to feel for lumps or other changes. Clinical breast exams are used along with mammograms to check for breast cancer. Two is self-breast exam. This is a physical examination of the breast done by the patient. This can be done either in a shower, lying down, or in front of a mirror. When is breast exam indicated? This can be done as a routine physical exam as recommended by a physician. It can also be done when the patient reports breast pain. Another indication will be the presence of unusual texture, lump or swelling of the breast or around the nipple. If nipple changes, redness, or unusual changes in the breast size is noticed. What are some challenges to performing a breast exam? If the patient is reluctant and anxious. Also, the results can be false positive, especially in self-breast exam. Financial burden to society and patient and possibilities, especially when follow-up plans are made after a false positive result. Lastly, there is no one-size-fits-all guidelines. We have different organizations, for example, ACOG, ACS, NCCN, NCI, and USPSTF that have different guidelines when it comes to breast examination. Now, how is the breast examination performed? First, introduce yourself to the patient and let them know what examination you'll be performing. Next, you will then adjust the table so as to make the patient comfortable. Then, appropriately drape the patient. Once that is done, you can go ahead with inspection. What are you looking for on inspection? You are observing for absence of one or both breasts, any skin changes, scars, redness, bruises, or nipple discharge. Next is palpation. To do so, ask the patient to lie flat and stand at the patient's right side. Place a small pillow under the shoulder. With ipsilateral arm above the head, spread the breast across the chest. Palpate breast with both the flat of your hand and fingers. There are three ways this can be done. First, in a circular pattern around the nipple. Second, along the radial line simulating a clock. Lastly, in vertical segments. Whichever way you choose, make sure it is done systematically and including the tail near the axilla. As you're doing so, note the consistency of tissue. Note for breast implants. Note any tenderness. Feel the areola and nipple. Compress the areola and note for discharge, and palpate nipple for elasticity. You will now proceed to do a focus examination. If a mass is present, where is it located? What's its size, shape, consistency? Is it mobile or not? If there is spontaneous discharge, compress the areola with index finger in radial positions around nipple. Note color, consistency, and quantity of discharge. Then palpate the axilla and supraclavicular area for lymph node enlargement. If mastectomy is noted, check for scars and lymphedema. The last component of breast exam is axillary lymph node examination. To do so, you will support the patient's relaxed arm. With one hand, palpate the axillary region, pressing your finger against the chest wall behind the pectoralis muscle and sliding downward. Palpate subclavicular, lateral pectoral, and central lymph nodes. Then palpate the supratrochlear nodes located 3 centimeters above the elbow. This is the end of breast exam. We will now move on to disease of the breast. These are mastitis, fibrocystic disease, fibroadenoma, breast abscess, and breast cancer. First, mastitis. This is also called acute bacterial or lactational mastitis. This can be caused by milk stasis or infections, most commonly from Staph aureus. It presents in most cases as acute inflammation. In case of mastitis, it is important to reassure and encourage the mother to continue breastfeeding. Fibrocystic disease. This is the presence of multiple cysts in the breast tissue. Management can be medical or surgical. When is medical management indicated? It is indicated when the fibrocystic breast is not increasing in size, when there is no nipple discharge, or psychological effect. With medical management, the aim is to stop progression, relieve pain, soften breast tissue, and hopefully reverse changes. Surgical management is indicated when patients are psychologically disturbed. If there is a presence of serous sanguinous, or bloody discharge, or when the fibrocystic breast is increasing in size. Fibroadenoma. We will also be looking at it. This is a benign breast tumor with fibrous and glandular tissue. It is the most common breast mass in women younger than 35 years old. Etiology is currently unknown. It has, however, been established to have a hormonal relationship with estrogen. Increased estrogen may stimulate growth, such as during pregnancy or before menstruation. What are some clinical features? Is it a solitary mass? Is it well defined? Is it non-tender? Is it mobile? Diagnosis is made via ultrasound and fine needle aspiration. This condition is, like mentioned, is benign, so regular checkups is all that is needed. Now, let's talk about breast abscess. This is a painful collection of pus that forms in the breast. What are some risk factors? Age over 30 years old, first pregnancy, tobacco use, having recurrent or chronic infections. Lastly, lactation history. For example, if there is poor attachment or sucking of neonate. Some clinical features are fever, local inflammation, fluctuant or tender mass. Breast abscess is diagnosed using breast ultrasound. Treatment is antibiotics and drainage. Lastly, we will discuss about breast cancer, mainly Paget disease of the breast and inflammatory breast cancer. This slide shows some characteristics commonly associated with breast cancer. Patient will often have a palpable mass, enlarged axillary lymph node, skin retraction. Nipple retraction or nipple discharge can also be seen, a peau d'orange, inflammation, or carcinoma in Cuirass. Lastly, let's talk about Paget disease of the breast. What is it? It is a ductal carcinoma that infiltrates the nipple and areola. Some features are erythematous, scaly, or vesicular rash that affects the nipple and areola. Other features are pruritus, burning sensation, and nipple retraction. The lesion eventually ulcerates and might have blood-tinged discharge. Diagnosis is done via nipple script cytology and punch or wedge biopsy. Treatment is surgical. Of note, this is often mistaken for mammillary eczema. This slide depicts a picture of a patient suffering from Paget disease. One can see how this condition can be confused with mammillary eczema. Lastly, we will look at inflammatory breast cancer. This is a rare, invasive carcinoma with dermal lymphatic invasion of tumor cells. Some features are erythematous and edematous skin plaques over a rapidly growing breast mass. Tenderness can be seen, burning sensation, blood-tinged nipple discharge. Lastly, axillary lymph node. Breast cancer would have metastasized in 25% of patients who present with axillary lymph node. Treatment is done via a combination of chemotherapy, radiotherapy, plus radical mastectomy. Prognosis for this condition is, however, poor. The 5-year survival with treatment is about 50%, and without treatment, less than 5%. This slide simply shows a picture of a patient suffering from inflammatory breast cancer. We will now go over a supplementary slide. This section will either summarize, reiterate, or provide detail to what was discussed earlier in the presentation. You may at any time pause the video for further reading. This slide shows some pertinent questions you want to ask a patient presenting with nipple discharge. This is a table showing possible causes of nipple discharge based on color. This is an algorithm for a patient presenting with nipple discharge. This is an algorithm for a patient presenting with breast mass. Ultrasound of the breast. This is what one will see on breast ultrasound of a patient presenting with simple breast cyst. This is what one will see on a normal mammogram. Lastly, this is a mammogram of a fatty breast. One can see on the red arrow a small cancer. This is the end of the breast examination presentation. Thank you.